Okay, hi Charl, we're back. We're going to do a final segment. Okay, Charl's an emergency medicine specialist. We're talking vaccines, and we spoke about sheep and herd immunity and everything. So my anaesthetist mentioned, and I don't even know that I know what 5G is, but that the vaccine gives you 5G, and his comment was he's chuffed because then he's going to have better reception, because at the moment it's like, but I've heard that it makes you magnetic. I've heard that it tracks you. What have you heard, Lou? Like
changes my RNA. I'm going to change.
Changes my RNA.
I'm going to die in 2 years' time because of it.
Yeah.
So let's put those all in one bucket. They're all social media driven scare tactics to try and remember, we've had anti-vax behavior for a long time. It's not new. Okay, it goes back. In fact, the guy who started the nonsense around the MMR vaccine causing autism was in fact a surgeon, Wakefield, I think was his name. There's always someone. Okay, there's always someone that has some powerful personal belief.
So what did he believe? He believed that
they had a flawed study which they said connected taking the measles vaccine resulted in an increased incidence of autism in a group of kids. Okay? The data was subsequently analysed to be complete junk. And there was no connection whatsoever. So the study was completely refuted.
Okay.
Right? But the concept remains. It lingers. There's always going to be a small group of people that strongly believe that all of these negatives around vaccines exist, right? And it's our job to just slowly and steadily unpick them and eliminate them one by one. Eliminate the science, and then people will still make a choice. Okay? It's comfy for people to make a choice, but they have to make a choice based on sensible science. If you still have some particular issue against a vaccine, that is still your right, okay? No issue. I would like to say, though, that if I can give you enough positive reasons, you'll come onto my side of the fence. Okay? That's really what we're doing. I don't want to be in a situation where I have to say, you have to take the vaccine, it's the law, or
is
you can't.
Is that happening?
In certain parts of the world and in the country, they are talking about vaccines being compulsory in certain areas, certain workplaces. It's mostly in a workplace type environment. So, for example, we think we'll get to a point where you can't work in a hospital unless you've had a vaccine.
So I saw that on the American, on the ASCO stuff.
That makes sense.
They are pushing for it to be law.
Teachers.
It may make sense there, absolutely. So we haven't got there yet, but you could imagine that that's logical.
It would be a pity to get to that.
The pity for me is that you don't like to force people to do anything. People don't like being forced. You'd rather someone says, okay, you know what, I used to think like this, I've now got a whole bunch of information, so now I've actually changed my mind. It's a very powerful thing to change your mind. If you have the ability to change your mind, you've made a huge step in any positive direction, right? So whether it's it was going to change my DNA, fine, we've established already in our previous segment, nonsense, it can't, right? So take it off your list, boom. It's going to inject something into my body so that the government's going to track me. Really? Google can probably find you on your phone a lot easier than the government can find you, right? So absolutely not. There is nothing that's injected into you that is trackable, traceable, detectable, nix. The only thing we can detect is your immune system is fitter. So we can go and test for antibodies and we can say, this person has been protected against coronavirus. Okay, it's quite difficult to test if you've actually had the vaccine, by the way. We can test if you've had the infection. But it's testing for a different protein. So if your concern is around one of those, we can easily eliminate.
Bits of babies, it was actually quite off-putting. Someone said it's the vaccine is done on
fetal cell lines. Another story. Okay, so remember that fetal cell lines, embryonic fetal material, is used in laboratories for culture of lots of things. Okay, and those cell lines, it's not fetal cells. It's cell lines. We have to be very clear and precise. Okay, so the original cell was used as the trigger, okay, to create these laboratory lines of.
Because the cells divide.
They're effectively petri dishes, right? So they create a laboratory cell.
So it's not like someone taking a water baby. That's
no. So the cell lines originally derived from aborted material, absolutely, but it was derived in. We're talking 70 years ago when those type of cell line strategies were employed.
Okay.
Those laboratory petri dishes
Yeah.
are things that are used today, modern lines. So the cells that are alive today are not those cells. Okay.
Yeah.
The cells that are alive today. It's a very sophisticated technique for growing things.
It's like that book,
in the laboratory.
Henrietta, around the cervical cancer and the development of the vaccine. It's an excellent book.
Yeah, development of vaccine, cell line technology is a very interesting science. Okay, and one has to, and all scientific techniques have got the potential for not interpreting them well, for abusing
But
them.
we're injecting nothing.
No.
You're tracing nothing.
We're injecting nothing. We're tracing nothing. You're not getting contaminated
anything
DNA.
else
You're
you've
not getting
heard?
anything
No.
else nasty.
Right. So, what about people who would rather take? I'm rather going to take ivermectin than the vaccine, and I see a lot of people like that. I would rather take, what's the malaria medicine? Hydrochloroquine. And then yesterday I had my really throw me under the bus. There's a whole lot of new on the social media about hydrogen peroxide, which is like flippin' dangerous.
Colloidal silver.
Okay. Yeah.
A disease that's scary, like coronavirus,
Yeah.
everyone's looking for something to treat it, right?
Right.
So if you can find something that treats a virus,
Yeah.
wonderful.
Have we ever been able to?
There are very few, yes, we've got antivirals, okay? So
That's
Oseltamivir
Yeah.
to treat influenza and a bunch of other viruses. So we've got some antivirals, okay? We've got
Okay.
antiretrovirals, we use those to treat
Yeah,
that. So we've got some,
Yeah.
okay? There are not many though. We've got far more viruses than we've got
They
antiviruses.
don't treat and cure any of the antivirals.
They will treat and cure certain viruses.
Okay.
Some they can't.
Okay.
Depending on whether that virus can keep changing itself,
Okay.
right?
Yeah.
So like HIV is like an ultra clever virus, and,
Okay.
that's a replicating virus, right?
Okay.
So different conversation altogether. People who are worried about DNA things should far rather focus on HIV technology. That's
Okay.
a very clever virus,
Okay.
unfortunately. But the alternative drugs that people are talking about is a logical search. People are looking for the holy grail of what can I take to treat myself for this virus. There is no antiviral right now that treats any of the coronaviruses. Not one. Okay? So that's point one.
Okay.
Point two is the various medicines that are being purported to work. They are being employed because people perceive that drug to have some beneficial side effect that is noticed in COVID-19 patients. So what's the drug you were asking about? Ivermectin, right?
Yeah.
Ivermectin's a great example. Ivermectin is an antiparasitic.
Right.
Okay, it was designed in the 70s, if I remember correctly. It's used to treat onchocerca and strongyloides. It's a veterinary medicine mostly, also used in humans.
Those are what?
They're worms. It's a parasite. Okay, so the drug is used to treat.
Okay.
That's its proper use, right?
Okay.
And it's a once-off dose, and we've
On
tested
people worms?
Yes,
Yes.
we can use it. Okay,
Right.
and that's what it's used for. Now, a lot of drugs like ivermectin and others,
Yeah.
have, in theory, anti-inflammatory properties.
Oh.
Okay, like
Like
hydroxychloroquine and anti-malaria, right?
Yeah.
They have anti-inflammatory properties.
Right.
So now people mistakenly connect the dots, okay? And they say, okay, can I use that medicine to decrease some of the negative effects of COVID-19, the lung infection, the pneumonia, okay?
Yeah.
And then what they'll even do is they'll say, well, here we've studied a bunch of patients,
Yeah.
and those people were taking ivermectin,
Yeah.
and guess what? According to their dodgy data, they think people did better. The current data, as we sit today, okay,
Right.
in a year's time might be different, but as we state today, right, there is absolutely no documented benefit for taking ivermectin or hydroxychloroquine for that matter as prophylaxis, prevention, or treatment for COVID-19.
Well, are some of these drugs dangerous if you take
All
it?
drugs are dangerous.
All right, we mentioned
All
that,
drugs
yeah?
are dangerous.
Yeah.
Ivermectin's a classic example because the correct dose for the worm infections
Yeah.
is a single dose, separate amount, okay?
Yeah.
It might be a week later.
Yeah.
We've got people that are taking this stuff every day, right? The potential liver side effects and other negative effects of the drug haven't even been explored yet. And people are taking it willy-nilly and people are prescribing it willy-nilly. So certainly my short message is around ivermectin is not on the table, it's not on the radar as an appropriate option. Now there is hydroxychloroquine that's designed for for use in malaria. It treats another parasite, by the way. So certainly the only type of medicines that we would be using, medicines like remdesivir, some very sophisticated drugs that are used in the hospital to manage some of the pulmonary disease, some of the lung disease that relates. And we might use steroids, for example, as powerful anti-inflammatories. Those are the type of drugs we do use that work. And that's why when someone goes to hospital, they might, if someone has severe COVID, they're going to hospital to get things like that. They need oxygen. They might need steroid treatment.
Is a drug, oxygen?
Absolutely. They might need remdesivir and a few other drugs.
What about all, what about all the vitamins and minerals? So you get COVID. I got COVID a month ago, and my GP gave me a list this long of vitamins and minerals. He says, take this, it'll help, but it's not going to make you better. Go to bed.
I like the bit about it's not going to make you better, go to bed. That was probably helpful. We normally start, there's no connection between megadosing of any vitamins and the prevention of disease or the treatment of disease. From vitamin C and colds to anything else, right? The vitamins are specific chemicals that work in body cycles, hormone production, different behavior in your body, and they all have a purpose. We need all of them. They're all essentials, right? Most of our vitamins we can get from a balanced diet. So if you have a balanced diet, in theory, you shouldn't need to take any vitamin supplement. Now, most modern people don't have a balanced diet. So most modern people, just because of the way we eat, where you buy your food, how your food is processed, how you cook your food, we lose slowly elements of that balanced vitamin intake. So a sensible nutritionist will advise you and say, your diet plus your lack of exposure to sun, for example, plus your activity suggests that you might need a little bit of vitamin D supplementation. Great, good advice. You might need a supplement in a different vitamin category because of your food. Some of the B vitamins, for example. Maybe your diet is, you're a vegetarian, for example, you've got a different protein mix in your diet, and you might need to supplement. Those are the people that should be supplementing vitamins. Taking a whole raft of megadosed vitamins from one of those mega scripts, right, to treat an acute viral infection, absolutely no connection to output whatsoever.
So I'm going to end with, because there's so much out there on social media, so technically these segments go on to Breast Health Foundation. We'll check around doctors in this. But what do you tell people? Because when I first started, you know how anxious I was about going to work, and you said to me, I put in playlist, I stopped looking at social media, Googling which doctors had died and this, before I went and frontlined in my little anxious state with my pink mask. But what do you tell people? Because there's so much anxiety out there, so everyone's popping everything in one to another. Where's the responsibility?
The short answer is we're in a world of instant information, right? So we're in a world of instant social comms. People have to be very cautious or restrictive about believing the source of information. Okay. Something that's on the internet is not a fact. Something that's on the internet is something that someone else photographed or videoed on a cell phone and
even medical
put it there, right?
Yeah.
So you've got no idea whether that's verified or not. For example, what we've just been talking about. Someone's listening to this. It is purely it's a professional conversation. It's an opinion. The opinion is from someone that's had some medical training. And so it's an opinion that you could take under consideration, right? But you still have to filter the opinion, right? And decide, well, do I trust the opinion from that doctor because they're trained in a very good place, they're experienced, their patients over many years have always done well, and they seem to be, giving me a very sensible message, which I understand. Tick, I'm going to trust that message. Just because I've seen it and it's been forwarded by 73 people and it was promoted by Dr. X in country Y does not make it valid information. In fact, that's very often the worst way to get that source of information. So the advice is always go back to the source of the data. The source of the data is usually bona fide medical websites are very good from big organizations. So in South Africa, the place to go for medical information is the NICD. NICD, National Institute for communicable diseases.
Yeah.
Right? And the NICD's got wonderful COVID and other disease-related
And
information.
reputable sources.
Reputable sources.
Okay.
It's an academic, well-organized website and virtual source
If
of
you
information.
want to do it internationally because you're scared of South Africa,
Cross the
or
Atlantic,
African,
go
yeah.
for example to America, go to the CDC. Okay.
CDC.
So the CDC, the Center for Disease Control,
Right.
is the NICD of America.
Okay.
Okay. And it's been in the game for many, many years. And
Okay.
the CDC website's very helpful. And you
Okay.
can look up all sorts of things about the medicines that might be used, what is
Right.
appropriate.
Right.
You know, you want to go and find out about a vaccine or ivermectin or anything else, you can go to the CDC website.
Anything around UK, Europe, anything like that you know?
Mostly connected to the universities.
Okay.
So the Oxford universities, the Imperial
Okay.
colleges of the world, they're producing
Okay.
good
So I
vaccine
think we
and
should
disease
put that on
information.
the bottom because that for me is important. How you get what source and where.
Generally speaking, in South Africa, the referral to the NICD is
Okay.
by far and away the best.
Okay, and to register, because we went with this on Sunday with Jan about people don't know, not that I knew, I'm sure you registered me, but registering on site, if you don't know how to register, I always have someone help me do everything, including drive from place to place.
So registering
Find a
for the
person
vaccine,
to help you.
you need to
don't-
register in South Africa on a system called EVDS, right, which is the country's vaccine registering portal.
And if you don't know how to do that,
And if you don't know how to do it, it's a very easy computer
Yeah.
exercise. It can be done on a computer or a
But you may not
smartphone.
have
If you
that.
don't have access to any of those,
Yeah.
you can register at the vaccine centres.
and if you don't,
Vaccine centres
Yeah.
will help walk-in people
Yeah.
that don't have the electronic capability to register.
but can you phone a friend and say, can you help me?
Take someone with you. You can get
Yeah.
someone to help you. You're there. It doesn't matter whose computer or phone you're working
Yeah.
on, as long as you're around, because you have to prove that you're you.
Okay.
Right? And the only the material we need is your ID number.
Right.
Right. And where you live or work will drive
Right.
the area that you're allocated to.
Okay.
That's it.
Done.
We don't need to know anything else. Everything
Okay.
else is age related. Currently, the government is trying to vaccinate more and more younger and younger people.
Yeah.
So we started with the over 65s and the essential healthcare
Right.
workers, and it's coming down, which is great. So right now, I think you can register if you're over 35, and pretty soon you'll be able to register if you're over 18.
And take any vaccine.
Anything you can get. You shouldn't be. That's probably a good finishing point. People say, "Well, should I take this one or this one?" You take whatever vaccine you can get.
Yeah.
Vaccine supply in our world is limited. So we are constrained by the number of vaccines we can get
But
into South
our
Africa.
regulatory bodies are good regulatory
Super
bodies.
safe and super diligent. That's why we've only got a couple of vaccines registered in South Africa.
All right. Thank you. Thank you. Good.